Good evening, everyone, and welcome to tonight's telephone town hall with Mayor Jack Young, Health Commissioner Dr. Jaraza, and City School CEO Dr. Santelises. My name is Lester Davis, and I'll be the moderator for tonight's event. Tonight we are discussing the city's continued response to the coronavirus pandemic and issues that matter to you and your community, particularly our city school students and their families. We will begin in just a moment, and we are excited to have you join us today. Before we begin, a few quick points to make. Right now, we're in the process of dialing out to thousands of people, so just stay on the line and we'll hear from Mayor Jack Young shortly. Also, we want to hear directly from you. If you would like to ask a question, please press 0 on your telephone keypad and you'll be connected directly with one of our volunteer operators. Again, if you have a question, please press 0. For the folks who may just be joining us now, good evening and welcome to tonight's telephone town hall with Mayor Jack Young, our Health Commissioner, Dr. Jaraza, City School CEO, Dr. Santelises. My name is Lester Davis, and I'm going to serve as your moderator for tonight. We will be discussing the city's continued response to the coronavirus pandemic, our plan for COVID-19 recovery, and issues that matter to you and your community, but of particular importance matters directed to our city school students and their families. We're going to begin in just a moment, and thank you for joining us. Right now, we're dialing out to thousands of people, and we want you to stay on the line, and you'll hear from Mayor Jack Young in just a few seconds. If you just joined us, please press 0, and that will put you in line to ask a question during this comment segment. I'm going to turn things over to Mayor Young.
It's Hologic. Come on, guys. Is this Hologic or Hologic? Good evening, everyone. Thank you for joining us for this town hall to discuss Baltimore City's response to COVID-19. As of today, we are 4,002 confirmed cases in Baltimore City, an increase of 11% since Friday, May the 15th. As of this morning, the city has 406 hospitalized with COVID-19 and 202 deaths. Today, Maryland health officials announced 1,784 new cases, a single-day high for the state, and 60 more deaths. The city recorded 113 new cases and 9 deaths. We are still showing percentage increases in both areas, and the positivity rate for tests is holding steady in the city at 20%. Baltimore City reopening must and will be guided by the data and science. That is the only way I can responsibly tell residents that it is safe for them to return to normal activities, even while maintaining social distancing. Please believe me, I would love nothing more than to be able to tell our residents that it is safe to resume businesses and other activities. But we are not there, and I would be negligent in doing so. There are 3 main things we need to be able to reopen. Number 1, a sustained decrease in positive cases and death. Number 2, increased testing capacity. And number 3, a robust contact tracing program. Today, we announced a new partnership with Hologic that will significantly increase our testing capacity in Baltimore City by allowing us to begin to process tests in our own lab, expediting this whole process. Our health department has already begun the huge lift of contact tracing in Baltimore City. Right now, they are reaching out to residents who have either tested positive or come in contact with someone who has tested positive. We need people to answer their phones. I know everyone screens their calls these days, and I do too. But at this time, I would just ask that everyone answer the phone, even if it's not a familiar number, because we really need to reach everyone. Everyone wants to know when we will reopen. Well, residents have a hand in that. The more contact tracing we can do, the more we can contain the spread and effectively test, which leads to us reopening sooner. We have a dashboard with racial and gender demographic data at coronavirus.baltimorecity.gov to help keep residents informed. We have ad campaigns across TV, radio, and social media to make sure we're getting the word out to all of our communities. We have 3 testing sites, Pimlico, the Rawlins Conservatory in Drew Hill Park, and Lake Clifton Park, as well as 3 mobile community-based testing sites in 3 neighborhoods, Cherry Hill, Brooklyn, and Hollandtown. These testing sites allow residents to obtain testing through walk-up capacity without the need for an appointment or referral. We started mailing out water bills on Friday, May the 8th, and that same day, the emergency COVID-19 discount program went live. The discount program will provide a 43% discount on charges for water and sewer usage and a waiver of bay restoration and stormwater remediation fees. I want to remind everyone that late fees have not and will not be assessed for overdue water bill payments, and water has not and will not be shut off for lack of payment. Last week I shared that I have directed our Housing Commissioner, Michael Braidman, to develop a program that will provide temporary rental assistance to those that will need continued relief. This will be a targeted initiative to address a very specific problem, where there has been a COVID-related impact and no other source of assistance has been provided. I committed $13 million to stabilize our residents and support them through the recovery period. All of this in an effort to provide residents with the needed resources and to help keep them informed as we progress through this public health emergency. Since the launch of our emergency response during this pandemic, the city has distributed over 2 million meals and nearly 20,000 grocery boxes. The expanded COVID-19 emergency food strategy will grow that reach over the next 2 months by providing a projected 2.5 million meals, 70,000 grocery boxes, and up to 12,000 household grocery supplement. The strategy also includes community groups and urban agriculture grants. As of 12 noon today, Baltimore's census response rate is at 49.5%. Our goal is 73%. Complete your household census before July to avoid a knock on the door from a Census Bureau employee. Census data is even more important amidst the COVID-19 pandemic. Local government use data to allocate resources during emergency situations. Call 844-330-2020 or visit my2020census.gov to complete the census. 2 weeks ago, I presented Baltimore City Public Schools with a $3 million check for use in closing the digital achievement gap facing the school children in Baltimore City. Our young people will always be a priority for my administration. They are our future, and we must nurture them and support them so they can be the future leaders of our city. Tonight, along with our Health Commissioner, Dr. DeRosa, I have the CEO of City Schools, Dr. Santalises, on the line to discuss City Schools' response to COVID-19 and the work they are doing every day on behalf of our students. Now let me turn it over to our Health Commissioner, who has been a rock star through this whole emergency. She began briefing the public at the beginning of February and has been on the top of this emergency situation the whole time. We are blessed to have Dr. DeRosa as the Health Commissioner for Baltimore City.
Great. Thank you, Mayor Young. Thank you all for the opportunity to talk a little bit about the work around the city's response to COVID-19. I will say that, as Mayor Young mentioned, we began briefing the public back in February, but even prior to that, our team, when we first heard the cases occurring in China, began to watch and prepare for a potential pandemic in the United States. So early on, we instituted what's called our incident command structure, which is really a leadership structure that allows us to be organized in the event of a major public health challenge such as COVID-19. And we have a couple main objectives as a health department. We want to minimize the spread of COVID-19, and we do that alongside other city agencies and other partners throughout the city. We want to make sure we're protecting our vulnerable populations. We want to also protect our healthcare workers through appropriate protective equipment. We want to support our hospitals with medical surge planning, and we do all of this by leveraging partnerships with other entities to bolster the city's overall response. So as Mayor Young mentioned, we've been really fortunate to receive some additional testing capacity. We know that is so important as we think about minimizing the spread of COVID-19, being able to recognize those cases early on. So we appreciate the opportunity to go out and do testing within the community. Additionally, contact tracing is going to be paramount as we mount our response to COVID-19. So I would reiterate what Mayor Young indicated, which is when you are called by the health department, please pick up and answer the call. Please answer the questions that you're being asked. And you answering those questions, it really allows our team to understand who you may have been exposed to during the time when you were ill and able to spread illness. Our team also provides you with support and additional resources if needed. Additionally, we would never ask you personal questions such as your credit card information, your immigration status, or your Social Security numbers. So all of the information we're collecting is confidential, and we're asking again so that we can make sure that we can stop the spread of COVID-19. It is with your help that we are going to be able to continue to fight this pandemic effectively. Thank you, Mayor Young.
Thank you very much, Dr. Shiraza. Dr. Santalises?
Yes, thank you very much, and thank you to Mayor Young for his continued support of city schools, our young people, and to Dr. DeRosa and her leadership and partnership around this health emergency crisis, as the mayor cited from the very beginning. Good evening, everyone who is listening in. By way of quick update, as many of you know, since school first ended, since there was a call to in-person schooling back in March, Baltimore City Public Schools in the early days has transitioned from that Monday after school was first called out to March 16th, starting with assisting and being part of Baltimore City's feeding program and operation. We are one arm of many as we partner with the Office of Family and Children and Recreation and Parks throughout that time, as well as through full meal distribution. The other piece has been the academic continuity of learning, which began with paper packets solely, and quickly, about 2 weeks in, began the distribution of Chromebooks and different devices, beginning with our seniors and juniors in high school to make sure our young people were able to complete coursework and graduate on time, all the way to even this past week, where we ended the first round of distribution to K-8 families that we identified through online and telephone survey. We will begin round 2 of that distribution beginning within the next week or so. Round 2 will be for many of the same families that might include siblings that were not included in the first round, and frankly will include those families who we were not able to reach through surveys, but for whom we know the need is still there, and our school principals have assisted, and staff and teachers have assisted in identifying those families. For everyone that I hope knows by now, the collaboration and the leadership from Mayor Young and our city council yielded an additional $3 million to support our young people's distance learning through technology. We have already purchased additional Chromebooks and laptops for student use that will be part of that next round of distribution. And also we are using a large portion of those funds to support internet Wi-Fi access for more of the families and students within Baltimore City Public Schools. So thank you again to Mayor Young for his part in that. And it really is helping to expand internet access and distance learning for our young people. As many of you know, State Superintendent Dr. Karen Salmon announced last week that school buildings will remain closed for the balance of the current school year, but it is important to note that distance learning will continue for all city school students until the last day of school. Officially on the calendar, the last day of school was supposed to be the 24th, I believe. We are now, the 22nd of June. We now have a waiver request in, as was voted and approved by the Baltimore City Board of Commissioners, for the last day for students and families to be moved to June 15th. And we are working with the Baltimore Teachers Union around the remaining days for staff development and additional learning time with teachers. So we will be working with them on that. In accordance with Mayor Young's continuation of our stay-in-place orders, all city schools personnel whose duties do not require work on site will continue to work from home, and any staff member whose duties require that they be on site will continue to observe all social distancing, including the use of appropriate PPE. Staff will have the opportunity to retrieve items from the buildings starting on May 26th. We know we had a number of folks who left thinking they might return in a week or two and really do need to get back and retrieve items. The same is true for families. Families can contact your principal because between June 1st and 12th, we will also be making sure that families can retrieve their items. I will end with just a reference to what I know continues to be on everyone's mind, and that is graduation. We want to celebrate our seniors graduating high school. We also have a number of celebrations planned for our 8th graders and 5th graders and even some of our kindergartners who are all at various points of their educational milestones. I want to encourage everyone to take part, as many as possible, in our citywide Senior Spirit Week, which is every day this week, and we've had a lot of participation via social media. And I was speaking with 2 or 3 of our senior student leaders earlier today. One of the messages that they continue to send is that the connection and communication for them is important. So I just want to encourage everyone to visit our website if possible and see all of the events planned for Senior Spirit Week. All graduations will be virtual, but I have promised our seniors that when it is physically safe, as soon as it is physically safe, we will plan an in-person celebration as well. And thank you for the time, and thank you for the opportunity to be here as part of this, Mayor Young, along with Dr. DeRaza.
Thank you very much, Dr. Santelises. Want to remind folks who have called in to join us, please press 0 on your keypad at any time to ask a question. I'm sure there are, in addition to the questions about COVID-19, I'm sure there are a lot of parents who may have specific questions related to education in our public schools. So we're thankful to have Dr. Santelises on the line to be able to field those. We're going to get to our first caller, Marlon from Northeast Baltimore. Marlon, you up? Can you go ahead and ask your question, please?
Thank you for taking my call. My question is, since the stay-at-home order has been into effect and you cannot go to places of their worship, my concern is, why is the church at the end of East North Avenue and North Milton Street allowed to hold worship service Sunday after Sunday?
Thank you for that, Marlon. I think we have Police Commissioner Harrison on the phone. I know you've done a lot of outreach, proactive outreach to the faith-based community, and we'll probably follow up with our health department teams and some other folks to do outreach on that specific one that Marlon just mentioned. But Commissioner Harrison, can you talk a little bit about the proactive approach that we've taken to try to get folks to voluntarily comply with the order?
Yes, and thank you, Lester, and thank you for that question. We've done a lot of outreach to make sure everyone knows exactly what is supposed to happen, especially when it comes to gatherings of church gatherings and faith-based gatherings inside of a sanctuary with more than 10 people. And what we want people to do is to voluntarily comply, because the stay-at-home order is still in effect. When we get complaints or information about a person or an entity or an organization or a church that is still holding services or is holding services, we go and we investigate that, and we make sure that the leader and those people in attendance are aware of the governor's stay-home order, of the mayor's stay-home order, and of social distancing. And we are prepared to take enforcement actions should we need to. We have not had to, because we've had voluntary compliance from many organizations that we've been in contact with. But with this one in particular, if you would make sure that our team on the phone has that information, we will investigate that, because that particular church has not been brought to my attention. But since it's being brought to my attention now, we will make sure that they are in compliance and fully understand the rules and are in compliance. And we will continue to do community outreach to all of our churches, synagogues, and mosques about how to hold services and when they can actually reopen for in-person services.
All right, thank you very much, Commissioner Harrison, and do want to remind folks you're able to dial 311. So if you know of or experience either a place of worship or a business that you believe may be operating outside of the bounds of that, you can dial 311, and the city will look into that. Next up, we have Diane Westgate on the line. Diane, what's your question?
Hi, I'm calling because I'm an 81-year-old senior who has been in the house since this all started. My daughter, who lives at a different address, I live alone, has been doing my grocery shopping, but I'm at the point where I would like to go to the grocery store with her, and we talked about it last night. We thought if we both put a mask on, and I rode in the back seat of her car, and when we got to the grocery store, we stayed 6 feet apart, and then kept the mask on all the way back home as she brought my groceries up to my porch. And so I would keep the mask on until she actually left. If you think that would be acceptable. I just feel like I want to get back to do some normal activities, but do them in a safe way.
Hi, Diane. That's a great question. This is Dr. Jarasa. I think certainly you've outlined all of the necessary precautions that we recommend in the event that you have to go out. And I will say that grocery shopping is technically considered one of those essential activities. At the same time, we also recognize that there are groups that are at a higher risk for more severe disease, that being older adults, or people with underlying health conditions like diabetes or lung disease or heart disease. So, going out even with your mask and keeping your social distancing is never going to be as safe as staying at home and avoiding all potential contact, but I certainly understand the desire to get back to normalcy. Another option, if you feel like you really want to get out, would be to potentially go out and take a walk. Maybe along a trail or someplace safe, as opposed to going to, a grocery store, which is certainly a very frequently visited area. But again, that's a great question, and I understand the desire to get out.
All right, thank you very much, Dr. Jarasa. I do want to clarify, our first caller, Marlon, had a really good question about faith-based services, and we do want to make sure that folks know that if you're a house of worship, you are able to have, and some houses of worship have had service, for instance, on the parking lots, where parishioners will come in their cars and they'll stay in their cars and they'll use microphones and megaphones to kind of get the word out, and then the order, if you're 10 or fewer, you are able to hold service. So we do want to clarify that there have been some faith leaders who have been complying within the rules and holding those services, and we appreciate them. Next up, I want to have Alma from Evergreen. You have a question?
Hi. I was concerned as to what it's going to look like when you open the schools up, so far as PPE, sanitizing hands, make sure that you're what's going to be in place for to put social distancing for the kids, seeing that we are allowed to have like 30-some kids in a classroom per teacher, and when they're coming and entering into the school, if their temperatures are going to be taken, is there going to be someone monitoring each child with signs and symptoms, and the readability of being able to keep their hands clean and also enforcing to keep their hands out of their face. I was also concerned about the circulating air that's going to be in the building, and HEPA filters in the air system, if that's going to be installed and different things like that. And what is that going to look like?
Sure, that's a great question, a great series of questions, and thanks for asking. And that is generally what we are in the midst of planning right now. So we, and I will reference initially State Superintendent Karen Salmon's guide that MSDE, the Maryland State Department of Education, published about 2 weeks ago, which is a nice overview. I wouldn't say that there are overarching directives there, but it generally outlines some of the things that we have been working through. And I will just tell you, having conversed with colleagues not only across the country but across the world in schools that are already opening, That is part of the scenario planning that we're doing now in terms of looking at our buildings, seeing, which possible varieties of configurations we might be able to take into consideration. I actually have a full-day retreat with my staff on Friday, where we are actually running through a lot of those possibilities. Clearly, all of those will be subject to what the overall guidance is from the health department here across the state and the mayor's direction in terms of where we are within phases. But that planning is absolutely what we're doing now. With regards to the cleaning and the sanitation, sanitizing of buildings, we have been, our folks have been pretty up to date on some of those pieces, particularly with regards to what are the guidelines, the updated OSHA guidelines for air circulation, all of those considerations. We have, frankly, been purchasing large amounts of soap and looking at alternative hand washing stations and configurations in schools. With regards to some of the checks that we do already, that will be done in collaboration and under the guidance of the health department and CDC guidelines. Again, as we have been working with colleagues in countries that have already opened up schools, we are thinking through what the implications are. So, for example, we already know that we need to work on different configurations for distributing meals, because gatherings in large cafeterias with 100 kids at one time is probably going to be a no-go for quite some time. But I guess the most straightforward answer to your question is we are planning for a number of scenarios. We are working with folks who are thinking through these both at the state level, clearly the city, national level and international, and that's some of what we're doing. We're actually walking buildings now and really taking all of that into account. But the final word will clearly be guided by what the conditions are and how they progress over the summer. And that, frankly, is how we entered the COVID crisis, was making sure we stayed in very close contact with what the health outlooks are. But yes, we are planning and have been planning for that reentry. And we also know that there are going to be some families and staff who are part of vulnerable populations, and we will continue to have distance learning options and continue to be prepared for the possibility of needing to go back to all virtual at some point. And so because, the future remains an unknown, we're basically preparing for a variety of scenarios.
All right. Thank you very much, Dr. Santelises. Next up, we have Diane from Westgate. All right. We will move along. I think we have Denise from the 25th Street area. Denise, are you with us?
Yes. Good evening. I thank you for y'all being available to respond to the community and the citizens of Baltimore. My first question is, will the municipal building do a retroactive backlog on the current BH2O program that was implemented last year? And if you had signed up and other people and they were approved, will they do a backlog on that, on taking off your water bill due to these new water bills coming out, as opposed to signing up for the new program? And also, will the Community Action centers be open for applying? Well, when this COVID-19 is lifted, whenever it's lifted, because the mayor will know, due to the circumstances. Will the Community Action Centers be open for applying for the MEET program when COVID-19 lifts off of Baltimore City? And if so, will the seniors and other people be able to go in and apply? And if not, say if it's after, because, the mayor's looking out for the safety of the whole citizen and city of Baltimore. And I thank God for that. And will they be able to, if you can't go in and it's not lifted due to safety protocol, how else will they be able to apply other than a computer if individuals don't have a computer or computer literate? And then the question for Dr. Saraji is, I wrote it down. Will they have the COVID-19? Is the testing voluntarily, and do they have people come door to door that do testing, or they'll have different sites if it's voluntarily for people to, go get tested?
Thank you very much. That was a really good question. I'm going to have Tisha take the first part of it, and then Dr. Jaraza can come in on the back half and deal specifically with the testing. But Tisha, I think early on we had a specific question about the BH2O Assist program and then the CAP centers. If you could you jump in for us?
Yes. Thank you for asking that question. You're exactly right. We want to make sure that we can extend benefits for those individuals that have already received approval for BH2O. So anyone who has been approved for the water assistance program, we are automatically certifying you for assistance for next year. So you do not have to reapply, and you will get communication acknowledging that you have been approved for next year. Your next question was related to the Energy Assistance Program, and you are right. June 1 marks the time to apply for energy assistance. We're doing the same thing with energy assistance. We're working through recertifying anyone who was previously approved for energy assistance, so that again they do not have to apply for this coming year. Anyone who is interested, who's new to either BH2O or to energy assistance, you can go online and apply online, but you can also download an application and mail it in to our offices. We expect that we will be able to have a call center open by mid-June. And if you are not able to access the application online, then you will be able to call the CAP Center and get assistance over the phone in filling out your application if you do not have access to technology, because we will be following the guidance of the mayor regarding keeping everyone safe. But to your point, we also want to make sure that BH2O and energy assistance is accessible to everyone, whether they have a computer or not. Thank you.
Thank you. Ms. Denise, to answer your question about testing, the city currently has 3 city-supported testing sites that are stationary, meaning you can actually drive up to our Pimlico testing site and schedule an appointment. You call 211, and then you can drive up or walk up to our Clifton Park and Druid Hill sites. Currently, those 3 sites do require an initial screening. Either your physician or, a clinical provider can order testing, or you can call 211 and be directed for testing if you are having symptoms. So we don't currently have testing that goes door to door, but last week we also launched mobile testing. So going into communities that we know were heavily impacted by COVID-19 and performing testing in those particular communities. So we did do that at 3 different sites. 2 were in South Baltimore in the Cherry Hill and Brooklyn location areas, and then the 3rd site was in Highlandtown, the Highlandtown area.
All right. Thank you very much. Next up, we have Wayne Carlisle from Armistead Gardens.
Yes, thank you. My question is for you all, that the face mask that you were saying last week, that this is mandated. We got to wear it to go outside, and that's understandable because none of us want to get this virus. And I would like to know, because of this mandate, is there any way that the city itself is going to be able to help out a little bit and like even with different locations that you could give out some of these face masks, because they're very expensive. If you try to go on online, or you go in there, they got scams. The other thing is that this like N95 mask and all these other things, and the ones with copper in them, and the only ones that I got a hold of, my wife and I, and that is a cloth, and you can only wash them so many times, and then they're gone, and you can't get them in the stores. Home Depot or Harbor Freight that had all that stuff, you can't even get the gloves. I understand that the first line workers out there, they're taking care of all the people, and we love them. They've done a great job, and I understand that. They come first. They should come first. But still, with us seniors and everything, that we need to go out to do, like we say, our normal functions of going and have to get food and different things like that, because we all don't have people that's going to go running around for us, running down what we need. And so we really do need some kind of access, a lot of us, for some kind of coverage there for us, hands as well as the face. But I guess more important would be the masking of the mouth and the nose. Thank you there.
Thank you very much. I know Sonny is on the line, who oversees our emergency operations, and then also I know Dr. Jaraza had given some information on face coverings, which can be any kind of cloth or T-shirt. So, Sonny, can you jump in first and talk to Mr. Carlisle about some of the work we're doing specifically on face coverings and PPE?
Sure, Mr. Carlisle, that's a really great question, and I know that's a concern that a lot of folks in Baltimore have right now is, what is the best way to figure out how to be in compliance with the requirement for a face covering for everyone's safety. So to your point, there are a lot of different face covering options out there, everything from N95 masks, surgical masks, homemade masks, and it can be a little confusing on what's best. So, one thing I would say is, if you are generally going out to pick up items, a surgical mask or a cloth face covering is definitely going to do the trick. Most residents will not require an N95 mask. Those are typically reserved for if you're being treated or treating someone. And for face coverings, for cloth face coverings, those can be used for any wide variety. You can use an old T-shirt to make one. I know a couple of weeks ago, Mayor Young did a little tutorial on how to do that, and we will be sure to continue to get that information out as far and wide as possible. I think what's most important, to your point, is making sure that your nose and your mouth is covered with some sort of a cloth covering, and we will continue to push out that information. But I want to turn it over to Dr. Daraja, who can probably offer more specific guidance.
No, I think, Sonny hit the nail on the head. Mr. Wayne, we understand those concerns, and you can use household items, an old bandana or scarf, and cover your nose or your nose and your mouth with those items if you need to go out. The only other additional resource that I'll offer is for older adults that are in need of support within their home. The health department is supporting our Maryland Access Point line, which is a resource line for older adults and their caregivers. So if there are particular needs that you have, please give that resource line a call. The number is 410-396-2273. Again, that's 410-396-2273. Thank you.
All right, thank you very much. We do have a number of callers who are online to ask a question. before we do, I did want to get some feedback on a question that we have that's going to help us as we do future telephone town halls. And for folks on the line, please participate. And the question for you is, where do you get information and updates most often regarding coronavirus in Baltimore City? Press 1 if it's watching the news or press conferences. Press 2 if it's social media. Press 3 if it's these particular telephone town halls or other virtual meetings that other folks host. Press 4 if it's communication from a local community or faith-based organization. Press 5 if it's emails, websites, or other written communication from the city. Again, for folks who are on the line who are calling in, we'd like to know where you get most of your information or updates. Press 1 if it's through the news or press conferences. Press 2 if you get your information from social media. 3 if it's from any kind of virtual town hall or virtual meetings. Press 4 if it's communication from a local community or faith-based organization. And press 5 if it's emails, websites, or other written communication from the city. And next up we have Elizabeth from Ashburton. Hi, you're on the line.
Yes, good evening, everyone. First of all, I would certainly like to thank and commend Mayor Young and Dr. Zaraza and the Police Commissioner for your continued stay at home and stay safe order. I thank you so much. My family and I thank you so much for being able to enforce that, because everyone is not compliant. But I have a bad back and I have to walk. So I go out with a face covering at least 4 mornings a week, and I saw a police car slowly following me today, and I turned around to show him that I had white hair and I had a mask on. But I was so happy that that was in place. So thank you very much. I know it's not easy, but you're doing your very best. And Dr. Santelises, I want to thank you and your teachers. I'm a grandmother, and I appreciate everything that the teachers have been doing to educate our children. I know that the need is great, but I, too, like the speaker from Evergreen, have a concern about the safety and the health of our children should they be able to come back to school. I'm a former elementary teacher, having taught all the grades. I know how many times children put their hands on surfaces and their mouths, and it is impossible for the powers to be to say that we will sanitize the buildings after each school day and on the weekend, because in addition to that, there needs to be sanitization within the school a day. So I don't know how you're going to do it, but please keep those things under consideration. And as this a pandemic continues to unfold, please address in some way the anxiety and the stress that the children are having. I guess from 3rd grade on, they listen to the news, they hear conversations between their parents and other members, and they now with this a new virus that is attacking the children and it's an inflammatory response, they worry. And they worry silently. And we are trying to keep our children physically healthy, but please just include something to help them emotionally as well. And there was another question that I had. Are there any summer plans in the work? But I think that Dr. Santelises has said all that we need to hear in terms of plans for education. I know everybody's doing the best, but I want to thank you as a mother and a grandmother and as a citizen of Baltimore, all of you, for the mammoth effort that you're continuing to do. And I know it's difficult when people are breaking the law. So,
I will just. I'm sorry, Lester. Should I wait?
No, please go right ahead.
I just want to say thank you because it really is the work. We have seen so many families just doing amazing things on behalf of their children at the same time that they are navigating what has been a challenging situation, and it really is our motivation to continue to try to serve in the best way that we can. I will say on the point about summer school, we did announce, and I've done a couple of talks, and I'll say here, we will be having virtual summer school this year, so please look in the next week or two for more information about that. We are trying to make sure that we can match young people to those opportunities based on their needs, and we do have prioritized groups of students, but we've also heard very clearly from families that they care about the progress of their students, which is no surprise, and so we will be continuing to offer virtual learning opportunities. And then I also just want to highlight something incredibly important you said, and that is the mental health and emotional health of our young people. And I know as a mom of 3 girls that they, you are absolutely right, they react very differently to different elements of this crisis and challenge. And so one of the things that we've heard back from city school students is just how helpful it is having our school counselors, our school psychologists have rotations where they check in on students. And again, one of the young people I spoke to earlier today said it really has been the call from his school psychologist that has helped him navigate what has been a really challenging period. And I would just also offer to any families in the city who have students in city schools, our hotline, we have a separate hotline that is set up to assist families in really supporting the wellness and the wholeness of students, because we do know, you are absolutely right, this is very challenging for children of all ages, frankly, not just adolescents and not just our youngest students, but all students are finding this challenging. So please do take advantage of our hotline, and we also are preparing, we have now, but we'll have more in the fall, where we really will be emphasizing to teachers, even in virtual classroom and learning experiences, to incorporate a lot of the social emotional wellness kinds of routines that help young people express and process what's going on. And again, the feedback we've received from teachers who are using those approaches is that families and students appreciate it. But thank you for raising that issue, because it's very important.
Thank you very much, Dr. Santelises. Next up, we have John from Hamilton Hills.
Yes, thank you. I was just wondering about a timeline for or the possibility of reopening the citizen drop-off centers and or resuming bulk trash collection.
Thank you very much, John. I believe we have Matt Garbark, who is the head of the Department of Public Works. Matt, are you on the line?
I am. Thank you for that question. It's a great question. We reduced our services primarily not for social distancing necessarily, but because we needed to have the staff who work in the other services available to come pitch in with our routine curbside collections. We've seen significant increase in curbside trash and recycling, and our bulk trash operators are most of the people that we have pulled to help with that increased workload, and they're also pitching in when we have employees who have been unable to work because they are ill and out. That being said, we do have 2 citizen drop-off centers that are open currently. One is at the Northwest Transfer Center at 5030 Reisterstown Road, and the other is at our Quarantine Road landfill at 6100 Quarantine Road. So those 2 remain open, and we will be reducing full services later on as the city begins to open up down the line. So I hope that answers your question.
All right. Thank you very much, Matt. Next up, we have Valencia from North Baltimore.
Yes, I was talking about the fact that I cough and I sneeze and I get hot flashes. I don't know whether it's menopause or what, but I would like to know if there's a way that somebody could take me to a place where I can get a free testing. I'm 72 years old, going on 73, and I have COPD. And I've been in the house like I'm supposed to, and I just want to get that straightened out. I want to know if I have it or if I don't have it, or is it an allergy?
All right. Thank you very much, Dr. Jaraza.
Hi, Ms. Valencia. So I think first, if you have a primary care provider, I would recommend calling your primary care provider, or if they have an after-hours line, calling that line to review your current symptoms and review your medical history so that they can provide guidance on next steps. If you don't have a primary care provider, then we do have a resource line. If you call 211, and they will direct you to a clinician if you lack a primary care provider who, again, will review your symptoms and understand what your medical history is and can refer you for testing. With regards to transportation to a testing site, I would give a call to the number I provided earlier, our Maryland Access Point, 410-396-2273, if you are in need of additional resources around transportation or anything else. Thank you.
Thank you very much, Dr. Jaraza. Next up, we have Shelley Landers from West Baltimore.
Hi, yes. Greetings to each of you. I want to say thank you all for keeping us safe because I do have a second underlying. I have asthma, as do my children. 17, getting ready to turn 18, one getting ready to turn 31. I thank Baltimore City for keeping us all safe, as well as New York, which is where my oldest is located. But my question is, in regards to having the virtual graduation, being as though that they came out today and delivered the We Love Our Seniors Congratulations Class of 2025, are these students receiving cap and gowns, as did the county?
So great question, and I have to tell you, that there are caps and gowns that we have ordered. What I will need to verify for you, which is based on schools, is how we're handling costs. Some high schools have folded those into the senior costs, others have not, so we're working with individual high schools. But yes, as of now, we will have cap and gowns, and I know that a number of schools, we provided guidance around that, are planning for graduates to be part of a citywide celebration as well as their own school celebration in their cap and gown. So if you have questions about that, you can either email me directly at the CEO address, or I would say for a more direct response, you can call your school principal or our city schools hotline. But the general answer to your question is yes, we have ordered caps and gowns.
Great. Thank you, Dr. Santelises. Next up, we have Robert from West Baltimore.
Yes, I would like to extend greetings to all of you and to Mayor Jack Young for keeping the city safe. I was listening when the mayor first started speaking, and he said there were 3 conditions on reopening the city. One was sustained decrease in cases. The second was decrease in deaths. And what was the third reason for reopening?
Okay, thank you. I'll read them again. There are 3 main things we need to be able to reopen. Number 1, a sustained decrease in positive cases and deaths. Number 2, increased testing capacity. And 3, a robust contact tracing program.
Thank you. And then next up, we do want to get in Tanya. Tanya, are you on the line?
Yes, I'm here. Good evening, everyone, and thank you for this town hall. My question, pretty much, Dr. Santelises touched on the answer to my question, And I had a question about distant learning or online learning continuing for the students. And Dr. Sanderlis touched on maybe that will still be in effect for those who have health issues or at high risk for returning to the public in that way. But my question is, what about the parents who choose to keep their children at home? Is that an option for returning for the fall, or would there be penalties or some kind of repercussions if the parents keep their children at home?
That's a great question, and you are not alone in asking that question. I've heard that from, a good portion of parents, a small portion in every setting. And I will say this, that we are working to make sure that there will be an online option for families with regard to their comfort level. You should also feel comforted, hopefully, in the fact that I have already flagged this for Dr. Karen Salmon, and it's a question that is occurring in probably most school districts across the state. So the good news with that is, we really are pushing and advocating for there to be increased flexibility of options for families, because we know that the comfort level is going to vary. Again, talking to some of my colleagues in countries that have opened, they too have said that there's varying levels of comfort for families in terms of returning to school. And some families, understandably, are going to want to see, what does it look like, what does it feel like, and then there will be families with young people with the kind of underlying conditions where it just is not safe. So that's a way of saying to you, first, yes, we are planning for that. Two, we are advocating at the state level for the kind of flexibility to be able to offer those options for families. And three, it's part of the reason why we are going to continue to push for increased access to technology and internet so that we can have that as a viable option. But yes, I have definitely heard from families, and we are working and hopeful that we'll be able to make that option available.
Thank you very much, Dr. Santelises, and want to thank everyone on the call. I'm going to turn it over to Mayor Young.
First of all, I want to thank everyone who joined us and participated in this telephone town hall tonight. Your continued engagement is very much needed, and your input and feedback is extremely helpful for us in government. As a city, we remain committed and focused on scaling up our response to this emergency while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. I cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. And we are asking all residents help in minimizing your contact with hospitals and healthcare facilities during this time. All residents should continue to practice social distancing and be vigilant about other mitigating practices like wearing face coverings as we continue the progress through this pandemic. Again, thank you for joining us for this call. Unfortunately, we could not get to every question. If you have any additional questions, please stay on the line and you will be able to leave a voicemail at the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, and a member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night and be safe. At the end of the event, any member of my staff will follow up with you this week. Thank you for your time. Have a great night.